I wish I was in the business where I could say, you're going to pay me every month for this thing. And then if you don't follow my stuff, I was just like, not my problem. You're on your own. I'm not covering you.
I'm not doing it.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
Welcome to episode 458 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs and Security First IT. And joining me is Donna Grindle of Cardin. What's up, Donna?
You know what you do to me when you enthusiastically yell Security First IT.
Yeah. That's
anyway.
Right.
So
what's been going on?
We're excited. We're excited about so many things. But what has been going on? Geez, what has been going on since we last recorded?
So
a lot.
Yeah, I think you came back from Chicago recently. I don't know if we talked about that yet, but
I think I was still recovering when we recorded. I think we recorded on Tuesday, so we're doing Tuesday again. But yeah, I see, that tells you how I'm too old for this shit. Oh, there I go. Gonna have to bleep me again. I am too old, even for this, clearly. But starting to recover, and now next week I have 2 more presentations I'm doing, and I've reached the point where it's clear that there's just too much demand for me to perform.
She's having performance anxiety.
Ain't no anxiety to it. I don't have a problem doing it. I have a problem recovering after I've done it. It's like being hungover.
It's a lot of work.
Well, and I'm very energized when I'm doing it. So, it's exhausting.
Yeah, it is.
But I got 2 more next week to do. And then I've got 1 in June. And then I think I'm done with, the conference season, as I call it. There's a spring one and a fall one. And I'm already just having to beg off of some of the fall ones because there's just so much. There's just too much.
Yeah. And on top of that, so many other things are changing. The new security rules coming out sometime this year. All the stuff that you currently use in your business is going to have to probably change to some degree.
Yeah. Well, I'm revamping everything for a reason. I mean, we know this SRA initiative, enforcement initiative. I'm revamping everything, up in the game for that. I'm up in the game because of CPGs and recognized security practices with Hiccup. And there's just so many parts of it that, I've tweaked along over the years. I'm like redoing big chunks of our processes to, take it to the next level, if you will, add in additional evaluations and documentation, because, documentation.
Yeah.
So I'm in the midst of doing that, plus all of this, plus, all of our normal gigs. So,
yeah. Well, I just have one question while you're doing all this, though, is are you going to make MFA mandatory?
Pretty much is where we are, is it not? It is exactly it.
Yeah. So that's going to be our topic for today, though. Is it time for mandatory MFA? I say yeah. In fact,
things, that's for sure.
Yeah. In fact, on some things, I told Donna that, when you've got like remote access tools, there should probably be like 5 FA. It's like,
if it's public facing, if you can get to a login by connecting to the internet anywhere, it needs a lot of FAs.
Yeah, that's right, FA. So yeah, you should. I mean, you figure all the people that are in 365 or Google, I mean, their login is public. the login page is public.
Mm-hmm.
So you just have to have the credentials. If you don't have MFA turned on, that's it. Pretty easy.
Yeah. And anybody that says it's too complicated, let's talk about why we're talking about that. So we'll get to that in just a minute, because if it's too complicated, imagine that feeling is what brings down the entire health sector in most significant data breach ever. As we've said, one click is all it takes. So.
Yeah. Or maybe the lack of click sometimes.
Yeah, the failure to click in the right spot at the right time. That's what it is. Yeah.
That's right. So before we get into that, we do want to say thank you to those who listen often and donate to the podcast. We appreciate that. We do have donors. If you want to know more about that, or if you want to know more about Donna and you want to work with us in any capacity, you can go over to helpmewithhippa.com, and there's links to our day jobs there and everything that we're doing to help the sector out. We appreciate that. All right, so let's get into the HIPAA briefs, because you've got something fairly interesting here.
Yeah, so and this is some attorney folks that I deal with. They sent this in. I was in on a discussion with them about this particular case that was announced. And so in this is a new release from the Department of Justice. And of course, it's about Atlanta. So, of course, that also made it across my, you know what I'm saying.
Yeah.
So the Insight Global, headquartered in Atlanta, has agreed to pay $2.7 million to resolve allegations it violated the False Claims Act by failing to implement adequate cybersecurity measures to protect health information obtained during a COVID-19 contract tracing activity they were hired to do. So this company was hired by the Pennsylvania Department of Health using federal funds to provide staffing for that contract tracing.
Contact tracing.
Contact, yes, thank you. Contract. They had a contract to do the contact. Yeah. So as part of that, and anybody that does these kind of contracts with the federal government, so like a contractor could potentially be, through CMS by getting Medicare. You agree to certain things. And so that's where a lot of that comes from. Is through any program that says that you are being paid with federal funds, that you understand that you are obligated to protect the information with adequate cybersecurity measures. And it doesn't mean you're necessarily under HIPAA because of the way you're doing the work, but you have to use adequate cybersecurity measures. So not going down the HIPAA rabbit hole here exactly, but what this is all about is in their contract, it says, hey, you're going to have health information and you have to use adequate cybersecurity. So that they didn't do that. They didn't keep it confidential and secure because certain information, PHI and PII, personal health information and personal, it was transmitted in unencrypted emails. The staff used shared passwords to access it, and the information was stored and transmitted using Google files that were not password protected and were potentially accessible to the public via internet links. So basically, they were just throwing the data around like it was nothing. No big deal. And in fact, there was a whistleblower in this case, a former staff member who worked on the contract tracing, was involved in saying, hey, this is bad, stop doing it. So from November 2020 through January 2021, they received complaints from the staff saying, hey, this is unsecure, it's accessible to the public, you need to start, and they didn't do anything until April So it was sitting out there the whole time. They did, in April, investigate the cause and scope of what was going on, strengthened their controls and all of those things, and issued the public notice and they did the data breach stuff. But not until they were ratted out, clearly. And the employee did get, because False Claims Act, you get a percentage. So the employee got like a hefty cut of $499,500.
Shoot.
But it's not like they saw it and then just ran. It doesn't look like. I mean, they tried to tell them for months, November, December, January. Then they finally gave up and started raising concerns elsewhere, which prompted the investigation, apparently, and the work being done. So here's the thing, though, is if you have any of these contracts, and this is where it gets really tricky. So if you are a Medicare contractor, you have a contract to provide care and get paid under Medicare, then you are obligated to secure the information. So do you know what's in those contracts? Because it's not necessarily saying you're obligated to comply with HIPAA all the time, and it's going to be variable. But the bottom line here is we've heard them discuss several times that in multiple discussions, rather, that they had an intent to look at other forms of enforcement for securing information. And the lawyers were asking that question of, is this we're going to start see happening in this arena? And I'm like, I know they're looking. I know they're trying to figure it out. And certainly with this, the False Claims Act, you have a lot more enforcement capability because it's based on, we paid you to do this and then you didn't do it. Which is very different than the way the HIPAA enforcement would work. So I would not be surprised if we start seeing this. And for those of you who are some level of contractor with the government, you're getting this funding, if you're not aware of what your cybersecurity obligations are under those contracts, now would be the time.
Yeah. Very true.
And note to self, the fact that the employees are going to start hearing more and more about this if it does start happening. And I know plenty of cases where employees come to us and they're like, we've tried to tell them. We're begging them to do it the right way. And they don't want to do this and they don't want to do that and whatever. So I'm not saying that I'm encouraging employees to do this, but I am saying that I know for a fact employees are doing this, trying to get people to do it and following basically the same steps what it sounds like were followed here and getting no actual results. And maybe we're going to start seeing this happen. So be aware of it and go learn about what you're committed to do under those contracts. So, anyhow, there you go. So now let's go on to the fun stuff.
Yeah. So the question that I posed was, is it time for mandatory MFA? And that comes from the hearing statement on Change Healthcare cyber attack and some interesting tidbits that came out of that.
Whoa. Yeah. I mean, we knew that we talked before about all of our folks being involved in this discussion, which has prompted such a huge evaluation of everything that's happening in healthcare due to the hearings in Congress and the Senate. What's interesting is, everybody said the CEO is coming. The CEO is coming. Well, we finally got that last week. So after our last recording, and, they published transcripts. I haven't had time to read them all. There's so much information. So I have pulled some of the things I feel that you should know about so that you don't have to go read all the stuff.
Mm-hmm.
Or at least be aware of it. So that's pretty clear when you start listening to this, that's where we're headed.
Yeah.
Is mandatory minimums for security, and MFA, mandatory MFA for any public-facing access, whatever it is.
Mm-hmm.
Period. End of statement.
Be interesting to see how they enforce all that. Is it going to be through the vendors forcing them to do it? Is it going to be, I'm looking for insurance to take up a big part of this to say you're going to have these things in place or we're not covering you.
Well, we already see that happening with the cyber coverage.
Mm-hmm. Mm-hmm.
If you don't have MFA, they're like, nope. If you don't have it turned on for all of your email, they're already saying we're not covering you.
Yep.
There's cases of it that I've heard about, and they're like, we got to go turn this on. Really? Maybe you should have done it before.
Yeah.
It's inconvenient.
I know. I wish I was in the business where I could say, you're going to pay me every month for this thing. And then if you don't follow my stuff, I was just like, not my problem. You're on your own. I'm not covering you.
I'm not doing it. So let's first get to a few little tidbits that we did learn. So the opening was from the chairman of the Senate Finance Committee, who was doing the one where Witty, which we've had our moment to try to get over the fact that the name is Witty, because we're those people. As David mentioned, we don't know the individual, but it would be very ironic and appropriate if they had zero sense of humor. Anyway.
Yeah. I mean, anything you says, it's a witty comment.
Yuck. I know when David saw me post the witty comments or something, and he's like, what? It's funny. No, it's not funny.
Yeah, I was like, why would he try to be witty? This is serious. I'm like, oh, he is witty. Yeah. Gotcha.
So, we went off that cliff. But anyway, so the opening, there were pulled a few things out of the transcript from his opening, and one that, of course, I had a big hoot about because basketball. So this is from Senator Wyden. I believe the bigger the company, the bigger the responsibility to protect its systems from hackers. UHG was a big target before it was hacked. The FBI says that the healthcare industry is the number one target of ransomware. It's obvious why. So he kept going back to the FBI's been telling y'all. And that came up several times, where we say, hey, they're telling you, pay attention. Finally, let's see, he put accountability for Change Healthcare's failure starts at the top. Before this hearing, I asked UHG which members of its board have cybersecurity expertise. And UHG pointed to NCAA President Charlie Baker, who signed some technology-related legislation into law years ago when he was governor of Massachusetts. That's the connection to cybersecurity on the board.
Huh.
And his statement was, Wyden's statement was, Mr. Baker is certainly an expert on basketball, but UHG needs an actual cybersecurity expert on its board. So that's a notification to all of the big industry players that everybody needs to have a cybersecurity person that is participating in running and advising those who are running the company. I'm just saying.
Yeah, and I'm going to say that needs to go all the way down to the smallest healthcare organizations.
Yeah.
If you've got 5 people and you're making decisions about your business without talking to somebody, whoever's providing your cybersecurity, then you're leaving yourself open. And
you need to vet that person too.
Oh, yeah, absolutely.
Not just, hey, everybody else uses them. Well, everybody else uses them, so they got to be good, right?
Yeah. The whole everybody else uses them is not a vetting technique.
Yeah, that's more like, how you decide about whether you're going to be friends in high school.
You didn't use that to vet your girlfriend. Does everybody else use them?
Oh, that was bad. Okay, back to the opening statements. Wyden's opening statement. Finally, the Change Hack is a dire warning about the consequences of too big to fail mega corporations gobbling up larger and larger shares of the healthcare system. It is long past time to do a comprehensive scrub of UHG's anti-competitive practices, which likely prolong the fallout from this hack. For example, Change Healthcare's exclusive contracts prevented more than 1/3 of providers from switching clearinghouses, even though their systems were down for weeks.
Oh, wow. I didn't know that.
Mm-hmm. I mean, that was huge.
Mm.
You know, and we talk about it in the MSP world.
Yeah.
I mean, this is what's happening everywhere. It's not just in healthcare, but imagine the MSP world at the rate it's going. The tools, and kind of touch on that a little bit to show that it's not just healthcare.
Yeah, in the MSP world, we've seen over the past few years, particularly the past 3 to 5, there's 2 or 3 major players that are just gobbling up all the small guys. And it's everything from payment platforms within the MSP industry to cybersecurity platforms, to vulnerability management platforms, or remote access platform, you name it. They're gobbling them all up, put them all under one single umbrella. And some of these platforms you know about because they've been part of major breaches. Mm-hmm. And particularly concerning is the fact that some of the terms of service these platforms have are not really great for MSPs. So there's seems to be at least grumblings at the very least, or grumblings in the MSP community. At the upper end of it, there's also people that are just jumping ship and moving to other platforms that aren't owned by these big mega corporations.
Mm-hmm. Well, thankfully, there's still some to go to.
Yeah.
You know? And that was also a big point, is you only have so many other options. Mm-hmm. And then you're not allowed to go to those other options because you're locked into these contracts. And then in the contracts, there are things like we can steal your clients on top of that. So
this is why I'm not a big fan of the massive consolidation, the whole let's have everything that we have under one umbrella. It sounds great to have all this integration, but when you're in an ecosystem and everything you have, your cybersecurity, your billing, your help desk, everything is under one platform, you've got one big major risk.
Yeah, and there's our capability for connecting things and triggering things now. There's no reason for us to do that. I know we've talked about it. One of the big reasons I went from having one big platform for billing, project management, customer relations, all of that stuff, I had it all in one, thought that was great. But then when the company kept promising but not doing anything in any of them, as far as moving forward, I split them all up.
Yeah. You tend to find that they do really well in this one area, and then the other 11, they suck. and so you're just better off. I understand it from an internal management standpoint. It's hard to manage multiple platforms like that, but you do spread out your risk when you do that. So there's pros and cons to both. You have to figure out which way you want to do it.
With now the integration, the APIs, the tools like Zapier and all these other pieces and parts, fully integrated APIs that allow you to connect, there's no reason you shouldn't be able to make that happen. Mm-hmm. Is one big thing. So, but yes, it's not just, it is a big problem. And it is across a lot of areas. And, we have that pendulum swing, and that means we're about to hit it. There's just too many things happening that means the pendulum is about to hit that wall and head back the other way. Mm-hmm. So what's going to cause that explosion, I don't know, but we're going to see it. And so now we got the testimony of Andrew Whitty, the CEO of UHG. And I pulled a few cool little statements out of there. some stats that he did. Cyber attacks to continue to increase in frequency and significance, with one analysis calculating that in 2023, cyber criminals collected an all-time high of over $1 billion just in ransom.
Woo.
That doesn't count all their other stuff. The scams and the crypto and all the stuff.
Mm-hmm.
Just in ransom payments.
Big business.
And $22 million for 2024 came from him. And he said, I made the decision to pay the ransom. And I don't think it's working out. Our company alone repels an attempted intrusion every 70 seconds, thwarting more than 450,000 intrusions per year. And these criminals continue to adapt and develop more sophisticated and malicious methodologies, and they have increasingly targeted critical infrastructure, including the health sector, and they're willing to attack everything to bring it down to make more money. So there's a lot more to the story, but yeah, that got your attention right there.
Yeah, and it's not shocking either. You and I both know, and we talk about this a lot, especially at the boot camp, about how many times the bad guys are knocking at your digital door.
Oh, it's constant.
And most people don't know about it. And, from the MSP side, it's kind of difficult to even express that without people getting alert fatigue. Like, I can't come to you every day and go, hey, you just had another 200 today trying to get in. Because eventually you just ignore it. So, but it's a lot, and it's all the time because your public facing IP address is out there.
Oh yeah. Well, even your home networks, that's happening.
Mm-hmm.
I've had times, and I know you have too, my home connection, it all of a sudden it's slow, and I go look and it's somebody pounding away trying to get into that router.
Oh yeah.
And I end up having to just turn it off to get them to go somewhere else so that I can open the door again.
Mm-hmm. Yeah, we get alerts constantly from like our website and things like that. We get an alert saying you have an increased level of people trying to get into your website. And it's not that they're getting in. It's just like, hey, whatever's happening, it's getting rough out there.
Yeah.
So we go and just kind of double check, make sure everything's locked down, and do our best to protect everything
and proceed.
Mm-hmm.
So then, to carry on with his note, cyber experts continue to investigate the incident. So he's getting into the details, and by no means am I covering the whole multiple page thing that he did. On February 12th, criminals used compromised credentials to remotely access a Change Healthcare Citrix portal, an application used to enable remote access to desktops. The portal did not have multi-factor authentication. Boom. There you go.
Yeah.
Once the threat actor gained access, they moved laterally in more sophisticated ways, exfiltrated data, and deployed 9 days later their ransomware attack.
Yep. So you've got two different issues right off the bat. You've got the fact that there are compromised credentials floating around somewhere. Mm-hmm. We don't know how they got compromised. I don't think.
I didn't see any discussions of it.
So you have the credentials that got compromised in some form or fashion, but then the fact that the portal didn't have MFA turned on, which I don't know exactly about Citrix portals, but most other portals, MFA is included. It's just a matter of turning it on. It's not like you got to go pay a bunch of money for this.
Well, that's not the case with like Microsoft. No, I just went through that with a client, and they're like, $12,000. Yeah, you got to upgrade everything so that you can get the version where you can turn this on. It's a whole nother discussion. Anyway, the key point here is that they did say they felt that those credentials had been hanging around out on the dark web for a while.
Mm.
Okay. Does that mean a dark web scan found it? Because we talk about the importance of doing these dark web scans on a regular basis.
Not only that, but if you've got a decent password manager, it often has the ability to look at your usernames and passwords and compare it to things on the dark web, and then gives you a report to say, these things are compromised credentials that you're using.
Mm-hmm.
Now, whether you're looking at the report is another thing, but a lot of these do that.
Yeah. But I mean, the information was likely there somewhere telling them that this was out there.
Mm-hmm.
So, but nobody's asking them about that. The big issue is, even if that had happened, if the MFA was turned on, it's very likely that this attack would not have occurred.
Yeah.
Is it certain? Nobody says certain. Now, if you are saying certain, somebody's telling you it's absolutely certain, I would have issue with that. I mean, there's a lot of variables that if this, and this, it's possible that could have.
Yeah, I'm certain that it's not certain.
Yeah. All right. And then the other thing that was in Whitty's testimony that I wanted to bring up was in the conclusion. There were several things, but the big thing was this one. We support mandatory minimum security standards developed collaboratively by the government and private sector for the healthcare industry. Importantly, these efforts must include funding and training for institutions that need help in making that transition, such as hospitals and rural communities. All right, that's exactly what the 5-year plan, that's exactly all of the things that we have been working on, that we are part of getting that done. So heads up. It's going to happen.
Yeah, I completely agree with it. And that's where we're headed. Yeah.
So, there's a whole lot of discussion and a whole lot of comments from a lot of the other stuff, is the senators and the other people going after this guy. Like, look, and particularly Wyden, the finance chair, I'm hoping Wyden, I'm saying that correctly, but at any rate, was like adamant that this is your failure to lead in this cyber attack caused these widespread disruptions.
Mm-hmm.
And they talked about the fact, we did a swift, horrible, painful thing, which was to shut the whole thing down. But that's what you do when you have a ransomware attack, number one. And number two is, based on what we're hearing, they basically had never gotten around to, since they paid multi-billion dollars to buy Change Healthcare in 2022, they were still in the process of upgrading the technology.
Right.
And the other thing was that their policy was that any public-facing connection had MFA turned on. So why was this sitting here?
Yeah. And it's not a case of upgrading technology as much as it's a case of a accurate and thorough risk assessment should have probably found this.
Well, or audits.
Yeah.
Just an audit. Audit. There's scans. There would have been ways to find it.
I wonder if it's one of those, hey, turn the MFA off so I can get in and we'll turn it back on later.
Yeah. Yeah. And can you imagine being that person? I mean, the person. I don't want to be that person. I don't want to know who that person is. I don't want that person's identity to come out, regardless of how involved they were in making sure the MFA wasn't turned on.
Yeah. Yeah, because that happens. I mean, I've got a thing right now. It's a platform I can't get into. For some reason, my MFA code does not work anymore. Mm-hmm. And so I'm like, you've got to turn it off so I can get in, turn it back on, and set it back up.
Yep. But then I got to make sure go through that.
Right. But I got to make sure once they turn it off, I turn it back on and set it back up.
There has to be a flag. There has to be a double check. And that's why all the technical people are like, I know how to do this. I don't need a checklist to go through. This is exactly why you would do that in a firewall change. Mm-hmm. Is, have I turned it all back on? Let me double check myself.
Yeah.
Anyway, so as a side note, in all of this discussion about how big they are and all the stuff that they own, because United Health Group owns a bunch of stuff. And there's a congressman from Georgia who's a pharmacist, apparently put up a chart showing all of their different subsidiaries and how broad and deep this thing was that UHG is, and was really fed up with how big it was, and really pushing on, we've got to do a better job of evaluating the actual impact of these massive corporations that have been built. But in that side note, Steward Health System on Monday filed for Chapter 11 bankruptcy. It has 30,000 employees, 4,500 primary and specialty care physicians, 400 facilities, 2 million patients annually, and it's like Texas, Arizona, Massachusetts, Ohio, Florida, all over the country. I think Florida and Massachusetts are the two biggest areas. But according to some of the articles I read on it, guess what? They're in negotiations with Optum, another UHG subsidiary, to purchase the primary care physician clinics.
Oh, wow.
So, and that was a complaint that we saw from the testimony before, that this has caused many of the physicians' clinics to just reach the critical breaking point where they're having to sell because they can't pay their bills. And then UHG is coming in after creating the problem, scooping them up on pennies on the dollar. I don't know. There's that accusation, and I know I saw this, but anyway, wow. That's what one of the physicians was saying in the testimony we covered before. There were many times that many different people brought up the size issue of UHG. And this was a point Warren made, that UHG brought up every link in the healthcare chain, owning the largest insurer, the largest claims processor, and the third largest pharmacy benefit manager, all under one umbrella.
Wow.
Yeah, I didn't even recognize that. And
that's a major risk.
Saying United Health is a monopoly on steroids, so not necessarily wrong there. Langford, Senator Langford, directly asked when patients and providers would be made whole of the payments and services they have struggled to access since the attack, and Whitty's response is, "I would hope that it's in the next month or 6 weeks." Okay, so that was beginning of May. Testimony. Attack occurred February 21st. We're 10 weeks in, and we're looking at, so when we tell people you need to prepare for weeks on end, we're not kidding.
Yeah. Yeah. And I've always been told you don't run a business off of hope. So just saying. I don't know if the next month or 6 weeks is a good response, or is just like, hey, let me respond to this. So maybe they won't ask.
I would hope, but I'm not gonna.
Yeah, exactly. It's better than saying one would hope.
Yeah, who knows exactly where that's going to go. But to close it out, there's an article in what is this? This is cybersecuritydive.com, and they have a healthcaredive.com. So pretty interesting stuff, but they did a 5 technical takeaways, and I thought we could close out with that.
Okay.
So number 1, legacy tech at change amplified the attack's impact. So before the attack, they acquired Change for $13 billion in late 2022 and was in the process of upgrading and modernizing an extensive amount of their technology.
Mm-hmm.
That is not easy to do. No. And for whatever the reasons, and we'll likely never know the details, but it sounds like they actually rebuilt it from the ground up because it was easier than putting it back to where it was. But it makes me wonder, where were they in that process if they were able to just say, screw it, let's do it from the ground up and rebuild it. I don't know. I've been down that path before myself where it's just like, okay, this is going to take longer, but not much longer. And on the other end, I'm going to be better off. So it sounds like that. Number 2, we already hit. Stolen credentials unlock the access. Ouch. That's bad. This is why we do the dark web scans, and my team was like, so-and-so has all these passwords that are out on the dark web scan. And I'm like, send it in an email. And they're like, we need to secure it. I'm like, it's already on the dark web. If somebody hacks into your Gmail account and, your Google Workspace account and steals it, it's not going to matter. So it's the same kind of thing. Number 3, incident response cavalry was called in. Now, he did go through in his testimony and pointed out Mandiant, Palo Alto Networks, Google, Microsoft, Cisco, Amazon. Everybody came and actually had somebody on site in Nashville. And apparently Mandiant is now going to join the board as a permanent advisor.
Yeah. Well, they're owned by Google now, right?
Yeah. So again, now we've got all of that's going on.
Right.
But at least 7 incident response firms and a third-party cybersecurity expert to help respond. So they brought in the cavalry. They didn't just say, hey, let's try to keep this quiet, because it wasn't going to be quiet.
No.
Response and recovery snags, that gets back to the legacy technology, and I would like for them to define that legacy technology. I would like to know just how legacy was the legacy.
Yeah, was it 5 years legacy, 20 years legacy?
Yeah, exactly. What was it that was that old, and how old? I mean, what kind of technology were they using? And I would love to know that, because that's going to give us a better understanding of the scenario that we faced, or that they faced. So it also meant that their prime, or their production, it said prime in this, but production and backup IT environments were not isolated. I got lots of questions about that. Why would you not be able to isolate them? Why does that require extensive updates to the technology? But again, and why did we not have a firm hot site switch over, knowing just how big you are? Those are my 2 big questions. But IT elements in the cloud were brought back online quickly, but systems in older data centers were weighed down by multiple layers of old technology. So, I mean, are we talking Microsoft servers? I mean, what are we talking old technology in data centers?
Yeah, who knows?
I mean, I have no idea, but I would love to know. I mean, I know there's stuff I wrote in the early aughts that's still running out there. So I know that it can be old. Was it that old? I didn't write it. Let me be clear. Not saying that.
That you know of.
No, not me. I may have written code that interfaced with it at some time. I will admit that. And then finally, the 5th thing, multi-factor authentication wasn't turned on. The company's policy is to have it turned on for all external-facing systems, but for reasons that remain under investigation. The portal used for the desktop remote access did not have MFA turned on. And his comment was, we're trying to dig through exactly why that server had not been protected by... They already know that. They already know. Somebody's already said, we turned that off because Fred needed it turned off.
Yeah. Because the CEO said turn it off. Yeah, I don't know that. We see that a lot in the smaller organizations where, Dr. So-and-so, he doesn't like that. We got to turn it off.
Yeah. I've seen sticky notes in the policy and procedure manual that say, we won't be following this per Dr. So-and-so.
Yeah. And that's when I say, here, sign this saying that you're not going to do it so that, I can not lose my E&O insurance or whatever.
So, but again, the fact that like this goes back to us asking the questions and then asking for proof, because we have seen that where the manual that's provided to the employees has a sticky note that says, yes, this policy is not going to be followed. We're not going to do this, but we have the policy. But if somebody would ask to see the policy per regulation requirements, they would hand them the policy and have no idea that it's not being followed. So anyway, but they do confirm that, at least he says, I can confirm across the whole of UHG. I'm sure they did go ferret out every other one, but I would love to know how many others they found. I doubt we'll ever know that. All of our external facing systems have got multi-factor authentication enabled. All right.
Yeah, I hope so.
So,
well, if you don't learn anything else today, you should go and look at all your systems that have MFA available and make sure it is turned on. And don't assume.
Yes, don't assume, because maybe it's not, it's turned on that you can have it, but it's not requiring it of every individual, which is another issue.
Yeah, because you could easily say, well, yeah, it's turned on because I have it. I have to go through MFA. Well, that doesn't mean everybody has to go through MFA necessarily.
True that.
So don't assume.
That, and do some dark web scans and actually deal with what you see.
Yeah.
And if you don't know how to do those or you can't do those, send us an email. We'll get you hooked up, because and we'll tell you right now, you can run 3 different services that do the dark web scans and get 3 different sets of results.
Yeah.
But the dark web is vast and dark. It's a dark and scary place.
And I can tell you, I've recently vetted a lot of those, and the free ones are free for a reason.
Yeah.
Just saying. But all right, folks, that's our show for today. Thanks for listening. Be sure to join us again next week. And remember, until then, the HIPAA is not about compliance. It's about patient care.
Help me with HIPAA. Let's get it right. Protect your patients day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.